is because of the similarity to polio in humans, similarity of, if you want, clinical symptoms to human. And the encephalomyelitis involving both the brain and the spinal cord. The transmission is fecal-oral, and unusual, the clinical signs, which is the ataxia, the convulsions, etc., tremors, which may lead to death. The mortality is pretty high, up to 75% mortality in pigs can occur. The virus also uses the oral route. It replicates in the gastrointestinal tract to local lymphatics, local lymph nodes, and from the lymph nodes it joins the blood circulation where it can enter the brain and causes encephalomyelitis. The lesions are common to lesions of viruses that infect the brain and spinal cord, and these include the necrosis, the vascular coughing, recruitment or infiltration, if you want, of inflammatory cells into the brain, and meninges.
Question.
Yes.
So on the slide it's saying that it's called Tescovirus 1, but you were saying that there's a Tescovirus 1 and a Tescovirus 2. So should we know that it's Tescovirus 1 and there's a severe and a less severe form, or should we know them as Tescovirus 1 and Tescovirus 2?
Tescovirus 1 is less severe, is mild.
Okay.
Tescovirus 2 causes a severe encephalitis or encephalomyelitis.
Okay.
Severe form of
So is it
encephalomyelitis.
supposed to be Tesco 2 on this slide?
On the slides, the slide is what's confusing me, because on the first slide, if you go back, it says that Tescovirus 1 and that there's a less severe form and a severe form. It doesn't really differentiate between 1 and 2.
Oh, severe and less severe form. Okay, so yeah, you're right. It's one which is it's one. It's one which is a severe form.
Okay.
So porcine Tescovirus 2 is mild. Okay, so diagnosis, it must be differentiated from other diseases that cause neurological symptoms. These will include pseudorabies and rabies. Now, pseudorabies is caused by herpes virus, and it has respiratory as well as a neurological outcome. And rabies is mainly, we know, neurological. Now, RT-PCR, because of this is an RNA virus, virus neutralization, cell culture in porcine cells, immunofluorescence, and immunohistochemistry. So, targeting the presence of the virus, whether it is in tissue of the brain or it is in the gut or lymph nodes. The immunity, there is a vaccine, inactivated attenuated vaccine, which is available, and obviously the control would be hygiene and slaughter of animal which that have encephalomyelitis. An important disease is circovirus disease. This is porcine circovirus. Now, the importance of this disease is its association with a number of syndromes. And those syndromes can vary from respiratory disease to abortion to systemic disease, etc. So a number of syndromes, which we'll talk about in a moment, are associated with this particular virus infection. The most obvious of it is this disease is sometimes called the wasting pig disease. because of the severe wasting associated with infection. In fact, this is also a question in the NAPI. It's associated with a number, particularly the systemic aspect of this infection. A number of organs are being infected and affected by the virus infection, but particularly the kidneys. And the kidneys shows white foci, and these foci are granulomas. Now, what is the main cell in the granuloma? Macrophages and giant cells. So basically what happens, this virus infects lymphocytes, it kills them, and as a feedback mechanism, the macrophages and giant cells are infiltrated in those organs, in the lymphoid organs, and in other organs to replace them. But they are infected as well, so the virus infects those macrophages. The other characteristic is the presence of stillbirth abortion. So this is an infection which occurs at later stages of pregnancy. And the characteristic feature of aborted piglets is the presence of ascites and the congestion in the abdomen. But most characteristically, if you open the chest and take the heart, is the presence of necrotizing myocarditis. That's inflammation of the myocardium as well as necrosis. A disease that causes a number of symptoms. So we know circoviruses that target monocyte and macrophages, and they target epithelial and endothelial cells. Hence, their effects is systemic. One characteristic of porcine circoviruses is that they, under electron microscopy, they show up like strings of pearls. So basically, they're aggregated viruses in strings, in the form of strings. That's very characteristic of circoviruses. So under EM, immediately you say, well, this is a circovirus. No other viruses can do the same. But also under light microscopy, what you find is the presence of inclusion bodies, several inclusion bodies in macrophages. And these are called botroid inclusions. It refers to the form in which those inclusion bodies are present. So this has porcine circo, it has also two types, porcine circo 1 and porcine circo 2. And it's porcine circo 2 which we are interested in. Porcine circo 1 causes a mild disease. Both, they are antigenically though distinct. So that means, injection of one does not protect the other. The potential significance, as I said, of this infection is the association with the number of syndromes. What are these syndromes? The post-weaning multisystemic wasting syndrome. So that's the wasting syndrome and a systemic disease. Porcine dermatitis and nephropathy syndrome, which involve, obviously, in this case, the kidney and the skin. Porcine reproductive failure disease, and porcine respiratory disease complex, as well as the virus is found in granulomatous enteritis, exudative epidermatitis, necrotizing lymphadenopathitis. So that means the virus is present in association with other pathogens. And in fact, the severity of the disease is due to predisposal, if you want, of this of pigs to these particular pathogens. What are they? Porcine parvo, mycoplasma, reproductive and respiratory virus, and swine influenza virus. All of these can predispose to infection with porcine circuit 2 and can cause a severe disease. Now, this disease is mainly, it causes high mortality, up to 50% mortality. So depending on the presence of pre-exposure, if you want, to other pathogens. Yes?
I just want to clarify on the, I don't know which slide this. Slide 60, where on the bottom it says it's enhanced by predisposition to secondary microbial infections. Are you saying that they come first and then circovirus comes, or circovirus comes and then those come?
No, predisposition.
Okay.
And so let's start with porcine post-weaning wasting syndrome. In the case of post-weaning syndrome, is obviously the wasting of the pig, the loss of weight, the significant loss of weight. In addition, it can be systemic, so it can affect a number of organs, including the lungs, liver, kidney, heart, and intestine. And when kidneys are examined, is the presence of these white foci, which are granulomas, basically macrophages and giant cell infected with the virus. So if one take a tissue from these organs, you can see the presence of botryoid inclusion bodies in macrophages, which is pretty diagnostic. The other disease, the other syndrome, which involve infection or necrosis of the skin, it causes ischemic necrosis of the skin, and particularly aneurial legs. But also it can involve the kidneys, showing glomerulonephritis, as well as the pigmentation, the white pigmentation on the white foci that I talked before. And the reproductive disease I showed you before, it involves a late term abortion, and it should be the piglets have congestion and have ascites, as well as necrotizing myocarditis. Now, when it comes to a diagnosis, obviously differential diagnosis is very important in this case, because it has to be differentiated from those that cause respiratory disease, those that cause reproductive failure, those that cause skin damage or necrotizing necrosis in the skin. So what are these diseases? Porcine respiratory and reproductive syndrome. This is, do you remember which stage of the pregnancy involved this infection, this virus? Late, exactly. So it's similar to then porcine circovirus 2. And is associated with wasting. So it has to be differentiated really from porcine respiratory or reproductive and respiratory syndrome. It has to be differentiated from African swine fever. Now, African swine fever is not obviously a US disease. So the foreign nature of this disease is important. But it can also cause cutaneous kidney petechial hemorrhages, so it can be difficult also to differentiate it to differentiate porcine circle from African swine fever. Parvo and pseudorabies also cause reproductive failure. but in the case of parvovirus, you know, the infection and the abortion can occur at particularly early and mid stage. The late stage, usually the fetus survives. And in case of pseudorabies, which is the herpes virus, there is no time limit when it comes to abortion. So it's difficult also, but this is a herpes virus. It can be easily differentiated from this disease by diagnostic test. Now, immunity prevention and control, the most important is that there is a vaccine, and that this vaccine is a recombinant vaccine. And what's interesting that it uses the porcine circle 1 as a backbone vaccine, or as a backbone, if you want, a recombinant vaccine that encodes for proteins that are involved in porcine circle virus 2 infection. So it's PC1 as a backbone, and the genes that contain that the PC1 encodes they encode the protein which belong to the porcine circle virus 2. And therefore, this vaccine can be administered. It does not produce an antibody response against PC1, which is good, because if it produces an antibody response against PC1, it's going to neutralize the effect of the vaccine. Whereas in this case, it can produce proteins that are important to afford immunity or to provide immunity against porcine circle virus 2. Questions? Okay, we're done. Yeah.